Good morning, everyone. Welcome. Thank you for being with us as always. On behalf of Ethnic Media Services and the Office of Community Partnerships and Strategic Communications, OCPSC for short, welcome to today's special news briefing on extreme heat, described as the #1 climate killer. Last week alone saw 4 consecutive days that were the hottest ever recorded on Earth. This is the first of 3 statewide news briefings to track the onset of extreme heat in California and what key state and local agencies, as well as community-based organizations, are doing to help people and localities adapt. Today, we welcome 5 speakers who will help us understand what is extreme heat and how the state is mobilizing extraordinary resources to protect its most vulnerable residents. You probably saw, colleagues in the media, that the Governor Gavin Newsom, this week launched a web page called Heat Ready California, heatreadycalifornia.com, which includes a multi-ethnic awareness and education campaign designed to keep Californians safe during extreme heat. Then we are going to talk about who is feeling the brunt of the impact and what steps people need to take to prepare and protect themselves and their families. Also, what steps the city of LA is taking to mitigate the effects of extreme heat and how this can be replicated in other regions of the state. And we have with us also 2 frontline healthcare providers who care or have cared for specific groups and what they advise their patients to do. We ask speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean, and we ask reporters to enter questions in the chat. We also request that speakers, if they can, monitor questions and respond on the chat where possible. We will send a video of today's briefing and expanded bios with contact information for each speaker to all participants later today. We want to thank OCPSC and its partnering agents for your valuable help in organizing today's briefing. Now we're going to start with V. Kelly Turner, who is Associate Director of Urban Environmental Research at UCLA, and she will give us a wider context for understanding extreme heat. Professor Turner, please go ahead. Welcome.
Hi, thank you so much for having me today to speak with you all about this topic. I'm an Associate Director at the Luskin Center for Innovation, which is an environmental policy and planning research center at UCLA. And we work a lot on bringing sort of the science of extreme heat to effective policy and planning. And so the first thing that I usually tell people when we're talking about heat is that there's really 3 buckets. The first is extreme heat, which gets a lot of play. This is heat waves, weather that's exceptional in some way. And that we know that extreme heat's going to get longer and worse in the future. And then that's made even worse by the way we build cities regionally. We put a lot of buildings and impervious stuff out, and that creates what's often called the urban heat island effect that makes cities...
Professor, please slow down a bit.
Oh, sorry.
Interpreters.
Sure. The urban heat island effect, which makes whole cities hotter than places that are not developed sometimes. But on the other hand, this third bucket is the human heat burden, and that is the way that people experience heat as they live their daily lives. And I argue that this is the one that matters the most to the quality of life of Californians, and it's also the one that's most inequitable. This is basically neighborhood to neighborhood. What kind of infrastructure, green and gray, is available to people. So one of the most important things we can do to address extreme heat and inequity is to think more specifically about shade infrastructure. And that's because primarily the way that people feel hot is from exposure to the sun. And so you can reduce temperatures on the body by about 30 to 40 degrees Celsius, as measured by a composite metric that we use in our lab, in just a few feet. And that's just by erecting a shade structure. And so we define shade infrastructure as all of the green and engineered sources of shade, including awnings, sails, and multi-story buildings, and the policies and planning tools needed to implement them effectively and equitably. because most Californians are effectively living in shade deserts currently, but the distribution of shade in the city is very inequitable. So I want to highlight the example of Pacoima, where we recently did a shade audit in a neighborhood and a school. And we found that the school has, for instance, less than 10% shade in the midday hours. And that's when kids are out having recess, recreating, eating lunch. And this is not atypical. This was a very typical California school. So what do we do about it? Well, we need to be really specific about settings like schools or residential or transportation, because different interventions are going to be needed in each setting. So in schools, play yards need less asphalt and they need more shade to effectively address the heat issues that children are facing. But we also need to address regulations. It can be really difficult, for instance, to just erect a shade structure in a school because the way construction is financed and regulated by the state. And if you're interested in this, you can take a look at, we have a series of heat policy briefs at our center. I believe the link will be sent out. One on the housing sector and one on schools. And one of the things that we argue in our schools brief, for instance, is that we need to center equity. The regulations and interventions are only as good as our ability to put equity front and center. And that's because even well-intended ideas can fall short if we do not. For instance, grant-based programs for school greening may be very difficult to access if a school doesn't have the resources or the personnel to go after them. I'm very excited that the interest in shade is shared by the state. We were just awarded, along with our partners, KDI, a planning grant, a climate adaptation planning grant to create a shade equity master plan for the unincorporated areas of East Coachella Valley. And this is something that we hope that every community in the state of California will have, is a shade audit, and then help them to make a plan to introduce this, because it is such an effective way to address the issue that matters to people, especially low income individuals who live and work a lot of times outdoors, more so than folks that do not. I would be happy to take any questions that you have when there is Q&A time, and to talk more offline as well about the housing sector, which is equally as important. Right. Thank you.
Okay, Professor Turner, I wanted to flag that when I gave the website of the new governor's page, I did it wrong. I said California as a full word, but it's actually heatreadyca.com. And in Español, cuidatedelcalorca.com. So, yeah, somebody might want to put that on the chat. Thank you so much, Professor Turner. So you talked a lot about shade, and you said that you also have some thoughts about housing. Can you advance some of those thoughts as well to us?
Yes, happy to. So one of the things that is the biggest low-hanging fruit for the state right now is that it's perfectly legal to rent a home that is too hot. So while there are regulations that define what is a tenantable dwelling for cold weather, there's not for hot weather. And that's just not commensurate with the reality right now that California keeps getting hotter and hotter. So, this is one thing that can be done at the state level. It can also be done at the city level. But one thing that we found, we were out in East Coachella Valley and we compared Palm Springs, which has a threshold. They're one of those cities that has passed a threshold, a maximum temperature threshold for tenants. And then we did some measurements in mobile dwellings in the city of Oasis, or the community of Oasis. And what we found is that if those mobile homes had air conditioning, they sometimes got hotter than the Palm Springs standards still, but those that didn't were above the Palm Springs standards all day long, and sometimes hotter than the air temperature outside. So this is an interesting case because it highlights both that there need to be standards and they need to be equitable. I mean, this is just across the highway from each other, these two communities. But it also highlights that there are housing forms that are, more precarious, and that we can do certain things with housing, augmenting building codes for housing that's new construction or retrofits. And then there's another set of regulations that need to be addressed for renters. And then there's yet another for mobile home dwellers and the unhoused. 40% of deaths during extreme heat events are the unhoused community. And so really looking across the different housing types will be important as we move forward.
Thank you, Professor. We're going to go ahead and invite Dr. Lucía Abascal, who spoke to us last year about vaccines, and she has come back. And we hope that she will give an overview of how the state is mobilizing its resources to combat extreme heat. Dr. Abascal, an MD and PhD, works with the California Department of Public Health. Please go ahead, Dr. Abascal, welcome.
Yes, hi, everybody. Thank you. Thank you for the opportunity to talk to you again. Last time we were talking about another public health emergency, COVID-19, and now we're talking about not a new one, but a very important one as well, which sadly we don't have a vaccine for, but we do have some measures. The issue is that not everybody can adhere to them in the same capacity as we were just hearing. So I just want to start by telling you just a story. I'm in Mexico right now because that's where I'm from, but I mostly live in San Francisco. And so I cannot complain about the heat there. But I was talking with a woman that works with me in a research project, and she lives in the Coachella Valley. And I was asking her, can you please tell me about your experience? She's from the Purepecha community, which it's an indigenous community from Michoacan, Mexico, and they've been living in the Coachella Valley for a long time, and they are mainly, they work in agriculture. And she said, yes, that's a very, very big problem. First, because, we have the immediate effects, right? A lot of the people that work in agriculture in the Coachella Valley live in really old trailers that are even from 1920. They don't have air conditioning and they don't have the capacity to install air conditioning. So she was telling me that they've reached even 125 and that the trailers get even hotter. So there's no safe place for them to go. And once they are outside, there's no shade. So that's a very big issue that's impacting their communities. And many communities like her. But she was also talking about the consequences that might not cause heat stroke. For example, she was telling me that one of the big cooling sites they have in Coachella Valley, Salto Sea, was starting to dry, and that was causing that some chemicals in the bottom were raising, and now that her house smells like sulfur. So just a lot of consequences, even in these places that are used to heat, and they've always experienced heat. What we're seeing, what we expect to see going forward is even a couple of degrees that can make things way harder. We know that heat is a main killer of all the disasters, of all the natural disasters. Heat is a main killer. I was reading the other day in the New York Times that just last year, 60,000 people died in Europe because of extreme heat, right? And we'll start seeing those numbers in the US, in California. And we at the state really want everybody to be prepared. And I wish we could do something, and we can, but it will take longer to change the course of things. But right now, it's very, very important for everybody to understand the dangers of heat. And that's why one of the main things we are doing is this sort of activities to inform the public about the dangers of heat, right? So what are important things to consider when thinking about heat? We like to focus especially on three. So first, stay cold. Stay cool. Stay cool. If you can stay inside in places that have AC, if you're fortunate to have it in your house, try to turn it on. If not, local libraries, malls, and other places where you can get AC, are good places to go. You can find in the website Pilar shared with us, there's a list where you can find cooling places by each county, and there you can direct people in your own counties to go to them. Then the next one is to stay hydrated. Very important to make sure everybody, especially high-risk populations, small children, pregnant women, elderly people, and people that might have a disability, it's very important that to make sure everybody's hydrated. Even though they are at risk, we know that even somebody that's healthy can suffer from heat stroke, okay? So everybody, this goes to everybody, stay cool, stay hydrated. And lastly, checking in each other. If you have an elder relative that might live alone, if you know somebody that's working on the fields, if you know somebody that has small children, let's make sure that we take care of each other. So those are the three main things we want everybody to know. And then lastly, what is the state doing? So first, we want to raise awareness. And then there's different plans to increase cooling spaces. And I mean, that's in the short term, but also in the long term, to also try to have more trees in cities, build more shades, as we were hearing Professor Vicali tell us. And those initiatives, there's a very big investment of millions and millions of dollars that the state is giving, because extreme weather is one of the priorities from the California Department of Public Health and from the governor's office. And yeah, I'm happy to take any questions.
Thank you, Dr. Abascal. Can you talk a little bit about what Cal OSHA is doing to protect workers, farm workers, and indoor workers?
Yes, that's an excellent question, and thank you for bringing it up. It was, I had to mention it, but we have to remember that workers have rights, and within those rights are the rights to take a break and also to stay hydrated and take drinks. They are going to be regular OSHA workers are going to be visiting some working sites to make sure that the employers are adhering to the rights of employees. So that's a big effort we are doing. And also helping employers come up with plans and know the regulations and the rights of their employees. So especially by providing, if people work outside, just monitoring the weather, providing shade, cooling spaces, hydration, make sure they're working the right amount of hours, make sure that they are capacitated to know, and their workers to know the signs and symptoms of heat stroke, which can include dizziness, leg cramps, feeling kind of like out of yourself, and then what to do if that happens to any employee. So those are some of the things that OSHA is working with employees to have in place.
Also, the previous speaker alluded to inequities, and we do know those exist. Can you talk a little bit about who are the most vulnerable populations for the heat situation?
Yeah, so I think we can talk of vulnerability two ways. So we have people that are physically vulnerable to the heat, even though everybody is. We have small children, elderly people, people with disabilities. So those are the people that their body might have a bigger, harder time regulating the body, right? Because when we are very hot, our body goes into overtime trying to cool it off. And then the issue really starts when our internal organs start warming up. So that happens to everybody, but the healthier we are, and not either young children or elders, it's easier. Also, pregnant women have to work double. So that also makes it harder for them. But then we also have people that, because of their living conditions, because their social determinants of health, cannot take all the precautions they have. So who are they? People that are work in agriculture, people that work outside, farm workers, they have a higher risk of being exposed to the heat. Also people that don't have cooling in their homes, or don't have access, for example, to public parks that might be shaded. We know that there's a correlation between like the heat people are experiencing and how their urban or not urban, their living environment looks like, no? So those are people that are also people that have no access to healthcare, people that might live far away and might not reach a health provider in time when they are suffering. So all of the things we know that put people at higher risk also affect during heat strokes.
Thank you, Dr. Abascal. I'm going to move on to Marta Segura. She is the Chief Heat Officer and Director of Climate Emergency Mobilization for the City of Los Angeles to share the steps her office is taking to mitigate against heat. Thank you.
Good morning, everyone. Yes, thank you. I definitely agree with everything that's been said by Professor Turner and Dr. Abascal. I want to say that I think cities across California and really across the nation are uniquely equipped to address this issue, because in Los Angeles, heat is our primary climate hazard, and it is affecting the city unequally. And just to expand a little bit more on the vulnerabilities of low-income communities, also UCLA, Dr. Eisenman at the School of Public Health did a UCLA heat risk map that demonstrated that the areas with the greatest vulnerability to extreme heat, with excess deaths and excess hospitalizations, were in the areas where you would expect, with low-income housing that lacks air conditioning, people with greater chronic illness because they live near polluting facilities, or where there is more pollution because of the urban heat island. And one thing I like to share with everybody is that heat exacerbates pollution, thus increasing the exposure to low-income communities without AC, or who are more likely to be pedestrians and mobile, taking the bus, walking to school. So this issue of shade equity that Professor Turner was talking about is an area that the City of Los Angeles is attempting to address with an equitable tree plan, and as well as bus shelters. And we now have a 10-year plan for bus shelters, and we can only hope that we can accelerate that plan so that we can address the heat adaptation needs of our very mobile, low-income community. So I also wanted to say that the energy burden is a huge obstacle and challenge to low-income communities, because they, even if they have AC, we've heard time and again that they don't turn it on because they can't afford it. So just providing AC is not the solution. The City of LA is working on building decarbonization or electrification strategy for existing buildings, which means our multifamily unit housing, a low-income housing, but we're approaching it very carefully, unlike other cities who kind of jumped the gun and said that they wanted to decarbonize all their buildings. We've learned from their experiences, and we want to make sure that the policies that we put in place actually weatherize these buildings, retrofit them so that they can have access to thermal cooling, the latest technologies like heat pumps versus air conditioners that use lower levels of electricity, therefore lowering the impact of the energy burden. But we have a long way to go. But LA does want to take the lead in providing more equitable capital investments in these areas that have been historically disinvested, because it's really important to accelerate our climate solutions and our heat solutions by investing in the areas that are most impacted. And I also like to say that now the heat season is longer. It's from mid-June to mid-November. There are more frequent heat waves, about 5 times more heat waves than they were 10 years ago. And that means that the body burden level of extreme heat is even higher than it was before. It's not your grandmother's summer. People can't cool down at night in most instances. That's why our cooling centers throughout the city and throughout the county are so extremely important. And we saw at last year's historic heat wave that we had more people using our cooling centers in South Los Angeles and the Valley. So we're attempting to put more cooling centers in the areas where they're most needed. For this weekend's heat wave, for example, even though it's not as high as last year's historic heat wave, we have 10 cooling centers that will be open just for the city of LA. All of our 73 libraries will also be open. And then you add that to the over 100 that the county has. And we have this Heat Relief for LA campaign to disseminate and distribute information. We're collaborating with over 75 organizations, the city departments, county departments. We're already putting messages in metro buses. We'll be putting them on bus shelters. We've used Lalo Alcaraz's amazing talent to help create the posters and the postcards. And they're multilingual. They're in 5 different languages. So I can't wait to share them with all of you. And I know Ethnic Media Services will provide them to you. And we also have like a call to action in that in that website that we'll provide to you. You can join the Heat Relief for LA network to help us distribute this really important information so that people know what to do. So it's not just about staying cool and being more hydrated. I think we have to prepare and plan. And if you're a construction worker and you typically have 3 cups of coffee in the morning before your day gets started, that's already dehydrating you. If you celebrated the night before with alcohol and then had coffee in the morning, you are at higher risk of getting heat exhaustion or heat stroke in the workplace. And I think the city, again, is uniquely positioned to convey to employers in the city of LA, for example, that they have a responsibility to provide more breaks, to provide more water, to ensure that they rearrange the schedule for times in the day that are less hot for outdoor workers. There's lots of things that the employers can do, and they will reduce their liability and reduce their risk by doing those things that improve the health outcomes of their workers. So hopefully that's helpful, and I can't wait to answer your questions.
Thank you so much, Marta. How do you think LA can help other cities across the state? I mean, not every city has a chief health heat officer.
That's
like
right. Well, City of LA, thanks to the support of Kelly Turner, is creating its own heat action plan. And we'd like to share the framework for that heat action plan and the final heat action plan with all cities. And I'm here also to have conversations with other cities, be a resource to other cities, and ensure that we're sharing our techniques that are working. And we learned a lot from other cities, for example. Lessons learned, best practices are really important because you don't have to be a chief heat officer to address these extreme heat issues. But what I have found that's different than just being a climate director is now I'm collaborating with the Emergency Management Department, the Mayor's Office of Public Safety. I'm in the Adverse Weather Heat Task Force, and therefore one of the determiners in the city or decision makers on deployment of resources during heat emergencies and other weather emergencies. So now I'm not only working on climate adaptation, but also emergency response and heat safety and public health. So I'd love to share more, and I'm a resource for anyone, any city who would like to talk to me.
You have your plate full, Marta.
I do.
All right. Thank you, Dr. Chang, for answering questions in the chat. That's very helpful. Anyone who sees a question that they can answer, please go ahead and answer in the chat. Please watch the chat, all of you, so you see the answers to that. And yeah, this is very helpful. So Marta, one phrase you said really caught my attention. It's not your grandmother's summer. That's something to remember, and it is. So we saw some of the hottest days, I guess, record hot days. I guess the highest temperature on record is being recorded today, I think in Death Valley, maybe. I'll go back and just throw the question out for any of you that have spoken so far, but specifically for the state, maybe for Dr. Abascal. Is there an emergency response that responds to this specific day, like today, or does it depend on the county? Do you know?
Well, in the city of Los Angeles, we work together with the county and the National Weather Service. And I think every region discusses the potential alerts that we're going to send out with the National Weather Service. So we have thresholds phase 1 through phase 4 in the city of LA and the county of LA, for example. And then once we are informed by the National Weather Service that they expect or anticipate a heat alert, and we've met those thresholds, then we decide to alert and notify not just the public, but the media, and work with LA County to disseminate that information. But I'd like to hear from the state as well, because I know the state is working on a category system that has not yet been implemented, but we very much want to hear about.
Yeah.
Sandra.
Yeah, sorry. So part of the things the state is moving forward and is working on is an alert system, but also a better tracking system to have a better system for reporting not just the weather to counties, but also heat related and weather related illnesses, so that if we see an uptick, we can better move resources to the region where we are seeing more, for example, more heat stroke or more deaths. So I think that's very important, because when you have a good monitoring system, and I mean, this comes from the experience also with COVID-19, you can better target your resources. So I think that's a priority of the state right now, just having data and information available so that the state can work with the counties and obviously with the federal government as well.
How is the state, the city, and whoever watching out for older adults in long-term care in this situation?
Well, I don't think the city has any jurisdiction over long-term care facilities, but we do activate all of our senior centers to provide cooling for seniors. And then our Department of Disabilities reaches out to the constituents with disabilities and makes equipment and resources and information available to them.
Anyone else wants to chime in? Okay. All right, let's move on. And I'm gonna welcome now Sandra Young. Sorry about, sometimes it's hard to pronounce for me, Spanish speaker here. A family nurse practitioner and founder of MECOP in Ventura County, who will share her experiences dealing with the impacts of extreme heat on farm workers. Sandy, welcome.
Thank you very much. And yes, I speak with my two hats that I've worn for 30 years, my primary care provider to an overwhelmingly farm worker Indigenous population in Ventura County, and then also as a equally long-term advocate and supporter for the MECOP, as you call it, Mixteco Indigenous Community Organizing Project, which is an extremely important organization in advocating for the rights of farm workers, and particularly Indigenous farm worker families. So just a few points that others have not mentioned yet. I would say that in Ventura County, which is clearly less heat challenged than Coachella Valley, but we have always seen heat-related injuries, heat-related illness in primary care, in the headaches and fatigue and rashes and dizziness and fever that people come to see us with. It's important as providers that we are able to recognize those symptoms as often being tied to heat exposure. And I think we don't do that good a job at recognizing those connections many times. So even though Oxnard is cooler than Coachella Valley, if you picture a strawberry field, which is completely open, where workers are covered head to toe in clothing, bandanas, to protect from dust and toxic chemicals. And then on top of that, you are in a situation where in part of the year, people's wages are tied to the quantity of fruit that they pick. so that you will literally see workers running with their heavy baskets of fruit to the trucks so that they can hopefully make that little bit of extra money that allows their family to pay the rent and eat, given the low level of farm worker wages. Similarly to the open strawberry fields, picture the what they call the high tunnels, the tarps basically, under which crops like raspberries and tomatoes are grown, where this is a huge enclosed tent which traps the heat, which traps the chemicals. Someone from Mixteco Project was just telling me that in the mornings when it's hot, you can see the fumigants rising out of these tents shortly before people have to go to work in them. So these are chronic conditions that are only going to be getting worse. Another problem that I want to raise is that while there are standards, important standards, at least in California, regarding water, heat, and breaks, that these are largely ignored in the fields. The Mixteco Project recently did a caravan tour, and out of 12 sites that they looked at, only 3 had adequate water available. Water is often far away from where people are picking, so that even to go and get water, you're going to be raising your body temperature even more. In addition, while I think it's the education component of educating people around excessive heat exposure is extremely important, that we need to remember that there are the majority of farm workers in California are undocumented. This means that they are very often not in a position to complain, to insist on their rights, to insist on their breaks, for fear of being fired, for fear of losing that tenuous hold on existence that they currently have. So, you know, I work with Mixteco Project, with Radio Indigenous, very important resource for the Indigenous community. They are already partnering with Heat Ready California. There are already Instagram posts and translation in Mixteco language to bring this message to people. But I would argue that more than education is required because of the enforcement factor, and that to me, a way forward is to mandate that every field with more than 8 workers have an elected worker representative who is empowered to monitor the health and safety standards in that field and to work with OSHA. OSHA is a very important agency, but their resources are very limited. And when growers know that OSHA is coming to town, they have a quick cleanup oftentimes. And so there needs to be an on-the-spot immediacy to the ability of farm workers to insist on the proper standards for heat exposure. And so that's the work that I'm still doing. I think our healthcare system has a long way to go to meet, be advocates for the farm worker community, to insist that pregnant women who are at very increased risk of fetal complications, miscarriage, and heat stroke are assisted with state disability, and understand that our healthcare system needs to be an advocate for our communities and not simply a passive provider of medical care. So I'll leave it at that and let the discussion continue.
Thank you, Sandy. Yeah, I mean, whenever I've had to interview farm workers for a piece, I always hear this, pregnant women work all the way to the moment they have to give birth in the fields because they have to. They're all the way so this is something that concerns you a lot, right?
Yes, well, and in fact, farm workers who are exposed to pesticides, to extreme environments are eligible for state disability insurance. But that's why I say the healthcare system has a much greater role to play in assisting our pregnant farm workers and helping them to understand the dangers of continuing to work late into pregnancy, even though sometimes, yes, there is no alternative, but we need to provide better alternatives.
Yes. Thank you, Sandy. We will have more questions after the last speaker, so please stay put, everyone. We would like to hear from Dr. Kimberly Chang. She's a family physician with Asian Health Services in Oakland about what she's learning from and sharing with her patients about extreme heat. Dr. Chang?
Hi, thank you, everyone. Good morning and almost good afternoon. I really appreciate this conversation. I'm learning a lot, and I'm so grateful for all of the work that our EMS is doing and the California Department of OP. Anyway, you know what I mean. And all of the journalists here for really getting this critical information out to our communities who are at risk. And I just wanted to say, it's not just the vulnerable folks who are at risk. If you remember, about a year ago, a family of 3 and their dog were hiking, and they all died. And it turned out they died from heat stroke on this hike. And they were, aside from the baby who is, more vulnerable, there were 2 healthy adults. And so, I want to emphasize that this is an issue for all of us, and we must also pay attention to those who are more vulnerable and at risk. So thank you for the work that you're doing, Sandra, with our farm workers who are really exposed. So I'm here to actually talk about the Asian American, Native Hawaiian, Pacific Islander populations that are particularly vulnerable to extreme heat. Everyone is impacted by extreme heat. And as you've heard earlier, heat is among the deadliest of all weather-related disasters, worse than floods, lightning, and hurricanes combined in the United States. The people who are most vulnerable to heat-related health concerns are older adults, because as you heard from Dr. Abascal, that they can't really regulate their body temperatures as well. People with disabilities and chronic conditions, pregnant folks, you heard from Ms. Young, young children, urban residents, those without easy access to air conditioning or natural shade, as you heard from Dr. Turner, among others, particularly for the AA-NHPI communities, Asian American, Native Hawaiian, and Pacific Islander communities. Studies found that from 2005 to 2015, the rates of emergency department visits for heat-related illnesses increased by 53% for Asian Americans. From 2005 to 2015, the heat-related illnesses in emergency departments increased by 53%. So that's huge. And from 2004 to 2018, Asian American and Pacific Islanders made up 194 deaths related to heat. That's a lot of lives that could have been lives lost that could have been prevented. California, in particular, has 4,649 Asian operated farms. Fresno County has the largest total at 802 Asian operated farms. that are affected by extreme heat. And in the top counties in California that are affected by extreme heat, there are an estimated 661,666 AAPIs who could be affected. 96,000 of them are over age 65. 124,000, almost 125,000 are children ages 14 or under. So this has big impacts and large, potential for harms. Henrietta asked, why is there such an increase in emergency care? Is it just those farming who are most at risk in this community? And so that gets to my point. I actually work here in Oakland, California. It's an urban community. You think that there's a lot of access to air conditioning and cooling centers, but the patients that I see, many of them are in crowded living conditions. They live in buildings that are that don't have elevators. We have a very much older population that we care for at Asian Health Services. And so these are some of the risk factors, right, for folks. It's not just those in farming. Urban folks are at risk as well. As we said before, anyone is at risk for heat-related health harms. And so I can share these statistics in the chat for sure. And so these are important impacts. And so when I think about my patients that I see day in and day out, and they live in walk-up buildings and they're older and it takes them a lot of energy to go up and down, I talk to them about fans, windows, cooling, light clothing. A lot of our older folks wear many layers of clothes. They're always very concerned about getting too cold. And, I tell them, don't wear so many layers of clothing, wear light, loose clothes, white clothes instead of black. They have to stay cool. And also to drink. We had a very robust chat conversation here about staying hydrated. Hydrated is not just liquid, it's also the electrolytes. And yes, there's, for folks who have diabetes, electrolytes with sugar can increase your sugar, but in that moment, you probably do need some of that sugar because your metabolism is ramped up and their bodies are using it and trying to stay cool with the evaporation and sweating and such, and the dilation of blood vessels and things, all the physiologic changes that go on. And so I would say also to our Asian community that, a lot of our Asian community drink hot water throughout the day. I would say probably switch that to room temperature water, even cold water if you can. That keeps the core temperature cooler. So these are some of the things that I talk to my patients about. I'm not sure if there's anything else, Pilar, that you wanted me to highlight, and I will drop these statistics into the chat.
No, thank you. Thank you. We have a bunch of questions in the chat for all of you. So let's go to some of that. So there was a question back there from Julia Dudley. Julia, you want to ask your question about the hottest days? Julia Dudley.
Yes, so thank you, Julia Dudley, Najib, Omni News. We keep seeing in the news about the hottest day, 62 degrees, the hottest day, 63 degrees, and we'll see that worldwide. How is that tabulated? Where are these calculations coming from?
Well, before the summer started, the World Meteorological Organization let us all know that this summer and in the next 5 years, we're hitting that 1.5 degrees Celsius a target that we had hoped to avoid, but that it's not permanent. It could be temporary, especially if we do more to accelerate climate solutions. But what I think is, and I defer to Dr. Kelly Turner and others, but what I think is key for local communities is the change between like say 70 and 80 degrees. It doesn't have to be super hot for people to experience emergency room visits or for people to experience fatalities. So if there's a jump in temperature and your body is not adapted, that's what causes the big emergency room visits and deaths. So I hope that partially answers your question.
I see Sandy going like this. Do you have anything to say, Sandy John?
Yeah, I would just say, there are a few factors in terms of relative heat that in somewhere like Coachella Valley, both individuals and companies and so forth are more attuned to heat. So perhaps have already done a better job of protecting workers, whereas in somewhere like Ventura County, which is not as extreme in heat. But again, as Dr. Segura just mentioned, when there's a rise in the level of heat exposure, that the system, the community is less prepared and therefore may suffer just as much as people in Coachella Valley who are dealing with 110-degree temperatures.
Thank you so much.
I would just like to add, I think that's absolutely true. I would concur with everything that's been said. And I would also flag that those extreme temperature data, those super high highs, they are good for like getting attention, but I would caution about hanging your hat on any one temperature metric. Mostly what we hear on the news is temperature, and there's actually many different ways we measure temperature that are just different snapshots in the process of heat exchange. There's surface temperature, but what we use is mean radiant temperature. There are other ones like PET is another acronym. They're made to measure the cumulative heat burden from all the ways the body experiences heat. So if you're talking about public health, it may be more appropriate to think about air temperature, humidity, exposure to sunlight, radiant heat off of surfaces, those kind of things. And those kind of air temperature regional metrics are more of a signal for longer term trends rather than kind of local community outcomes.
That was very helpful. Thank you so much. There was a question in the chat by Tanu. Henry, Tanu, you want to ask your question about coordination?
Yeah, sure. I mean, hearing all the speakers, I'm hearing all these great initiatives happening at the city level, state level, even the federal government, the governor's new page. And I just had a question about coordination, just to make sure like all of these things are in sync and there's not too much overlap or duplication of efforts. How do you guys, I guess, coordinate your efforts so that you're actually expanding your outreach as opposed to duplicating them, or are all these efforts like in conversation with each other?
I can take that from the state level. So, I mean, what we do is a little bit like an umbrella of what the different counties do, right? And heat is one of the public health priorities at the moment, but it's not the only one. So just like we do with other diseases that are reportable at different levels, at the county levels, we are trying to do the similar thing with COVID-19, and just to work with the counties to aggregate that data, to aggregate that data and give information quickly to the counties. Shh, ahorita. Sorry, my daughter wants me to draw a banana. So we're working with the counties to make sure they have the resources they need, but we are not the people on the ground. I mean, OSHA, yes, I mean, it doesn't work as it should, but they are more on the ground. But our work is more of a coordinating and aggregating and also resource management side. And I guess the city, Marta can give a better picture of how LA manages that. I have to go draw a banana, sorry.
Well,
yeah, well, coordinating across the city and with the county, the National Weather Service and the state is a priority for us. And I think the National Weather Service alert system binds us all together so that we are one message, many messengers in terms of our alert system. But also what's really important for local communities and cities is to create a campaign like we are, the Heat Relief for LA campaign, because we can't just notify people a day before the heat wave and expect them to be ready and prepared. It's a long-term game of having people shift their mindset on how different heat seasons are now, how much more dangerous they are, why it's so necessary to prevent deaths in their community, to prepare in advance. And talking about talk about things like, yeah, drink less coffee, drink less alcohol, drink more water. These are, people don't like to be told what to do. So how do we, in a friendly way, in a collaborative way, try to change people's behaviors so that they can protect themselves? It's really a communications challenge. And that's why I'm so happy and excited to be here with Ethnic Media Services, because you know how to convey this information in the best way possible. So it's really about the short-term, long-term messaging in advance, preparing in advance, and then the alert system that comes at the end. And that's where cities, counties, and states really need to coordinate. And we do. We could do better, but we do.
It's a good thing that you talked about that, Marta, because just the other day I was on Facebook and a person I know posted something about it being a lie that the Arctic Circle is getting warmer or something like that. I can't even remember. But I was like, what? I mean, so we're talking about, with vaccines, we had this information. Are we having this as a problem here too? Anyone?
I would say absolutely. Absolutely. We're in denial of things that don't affect us directly. And people of color and ethnic groups are also predisposed to, the social media from other countries. I read about the Spanish social media misinformation during COVID. That was really hard to hear and hard to read, but it made it very clear to me that there is a very broad global effort to misinform communities. And we have to work against that.
Anyone else wants to chime in on that?
I mean, I can add a little bit. I've done some work on the misinformation aspect. And I mean, I started that work with COVID vaccines, and now I've just moved into misinformation period because it's such a big thing, right? And the crazy thing with weather is that we are experiencing weather right now. No, it's not like, yeah, the Arctic, that's easier to dismiss, but you cannot be in the middle of a heat wave and dismiss the heat wave. So I think there's like this complete disconnect of how the weather is connected and how our actions here where we are affect others. And I think that's the thing that's very disconnected, and why communications, as Marta was saying, is so important. And just try to find a way when how people can understand how weather is connected and how what is happening in the Arctic affects what happens in California and the coral reefs in Florida, right? How everything is connected. And at the end, we are experiencing the effects of all of this warming. And I mean, heat stroke is one of the fastest fastest consequences of extreme weather, right? Because it happens like that, but we're also going to start, I mean, water, if people cannot access water, if we can't access food, and it just goes like downhill from there. So of course that information is very, very important.
Yeah. Thank you. I think I'm going to go around of everyone to close because we have 2 minutes to go. We probably will be over the hour for 1 minute or so. So for everyone, during the pandemic, we were talking about vaccines all the time, what people can do, vaccines. So what can we do as media? And what is the message that you want us to take to people in this case? Let's start with Professor Turner.
Oh, well, I think as the media, the most effective thing you can do is to help highlight some of the policies that are currently being put into place both at city and state level. There are a number of bills that are going through legislation this year. We've seen an uptick in heat-related legislation. Unfortunately, many of them either die in appropriations or they get turned into fact-finding bills. So getting sort of awareness that city and state leaders are acting, and that, you know, people really need to show that these are issues that are important to them.
Okay, Lucía Abascal, Dr. Abascal.
Yeah, just to remember, I think I would close with the three recommendations of stay cool, stay hydrated, and take care of each other.
Thank you. Okay, Marta, Segura?
Yeah, I think I want people to remember that what I said earlier, it's not your grandmother's summer. It's not the summer from 10 years ago. It's much more dangerous. So you have to prepare and plan in advance. I urge you to look at our Heat Relief for LA campaign poster. It has suggestions on how to listen to your body, what steps you can take, how you can prepare, and who you can call to make sure that you have the relevant information in Los Angeles to prevent heat stroke or heat exhaustion and protect the rest of your family. I think that's a good message to send out to people because most people don't think summers have changed. They don't know that they have changed.
Yeah, good point. Sandra Young?
Yeah, I think I would just say that, you know, under COVID, we finally had some light shown on the essential farm worker population, the people who feed us in the world, and the risks that they faced under COVID particularly. And hopefully that we'll continue to shine that light on as climate change affects us more and more, that our farm worker population, our agricultural workers are among the highest risk folks for heat-related injuries.
Okay, thank you so much. And Dr. Chang?
Yeah, was the question, what do we want people to remember the most?
Yeah, what is the message that the ethnic media can bring to people about?
I think the most important thing that I would want people to remember during the heat, very hot days and things is think about your community, think about people. You might feel hot individually and be able to regulate your temperatures, but think about others who are not able to do that, whether they're houseless, whether they're working in the fields, whether they're older or little, and just think about each other.
I want to add that I this morning put out water for kitties on the street, so take care of animals as well, you know.
Exactly.
All right, well, thank you everyone. This was an amazing discussion, really great, and we appreciate you for being here today. I hope our media take this message to their audiences. Thank you so much.
Thank you.
Thank you.